Good morning. We're going to take a couple of minutes and let everybody get joined. So we had quite a few, almost 200 people registered for this webinar, so we'll give them a little bit of time to get on. This is the legislative update for Texas. If you're from another state, sometimes we have guests. This will be specific to Texas regarding legislation that has been introduced over the last few months during the Texas legislature. So everybody's streaming in. Welcome. Just so you know, this workshop is being recorded. Everyone, so if you're hi Susan, welcome. Love to have you drop in your name and who you're with, so we have an idea of who's joined the webinar this morning. Or your name is there if you just drop in who you're, what organization you're with and what your position is. That would be great. Ama. Okay. I'll just let everybody keep joining, and we're going to go ahead and get started. Few logistics. As I mentioned, we're being recorded. Everybody is automatically placed on mute, and you can listen in with your computer, or if you're not hearing very well, you can switch to using your telephone for audio. As I mentioned, we'd love for you to introduce yourselves in the chat so we know who's with us this morning. If you have questions, there is a separate Q&A that you can use to enter questions. Chat is more for making comments and telling us who you are, and then we'll watch the Q&A for actual questions, which we'll answer at the end or during the webinar if it's appropriate. And then we will do a follow-up email after that will provide the link to the recording as well as a PDF of the slides that we're using today. So I hope you enjoy this and learn more about what's going on in the legislative arena this session. Just a little bit about the organization, Action for Healthy Kids. Hopefully most of you know who we are. We've been working since 2002 on helping schools be a healthier learning environment. Its focus was started because Dr. David Satcher, who was then the Surgeon General, said we have an obesity epidemic and we need to work on it from youth to help them understand how important nutrition and physical activity is to their health and help them grow up to be healthier and more informed adults. So for the last 20 years, we've worked with districts, we've worked with schools, we've worked with other organizations to help make schools healthier learning environments. You'll find a lot of great resources on our website, actionforhealthykids.org, everything from tip sheets to training opportunities. We do have some grants, but they are at the district level. We do not have any school grants right now. And one of the most exciting grants we have is focused on rural communities and small school districts. So you can learn more about this on our website, and these are up to $150,000 to improve your school meal programs. So if you're a small or a rural district, please look at this grant and consider applying, and the information is there. Or if you can't find the information, reach out to me and I'll make sure and send you a link. Today, I have Joel Romo with me. I have a little bit of information on one specific bill I'll share later. He is going to give you the big picture on what's going on and share what the Partnership for Healthy Texas has been working on. So I'm going to turn this over to Joel.
Great. Thank you, Michelle. I look forward to visiting with everyone about the upcoming legislative session, or the current legislative session. And we want to make sure everybody is familiar with what's happening in Texas We are well into the 88th legislative session. The session is set to adjourn May 29th, so we've got a little over 45 days left in the current session. It's getting more exciting by the day at the legislature, dealing with everything from the state budget to numerous social issues to, I'm sure many folks here are aware, there's debate on school vouchers. So we have quite an exciting time. And then we're also, little background on myself, I Vice President Governmental Affairs for the Cooper Institute. Also, I have my own consulting firm, Texana Public Affairs, and I do a lot of work with various public health groups around the state. And I also, in that world, I get to serve as a legislative chair for the Partnership for Healthy Texas. And I will give a little bit of background about that coalition, as well as some of the bills that are important to you in terms of how they're going to impact children's health in our schools. So right now, as I mentioned, the legislature is constitutionally required to meet every odd year for 140 days. We're well into the session. I'm not going to go into too much. We did see this slide's a little outdated. We saw a record 8,000 bills filed this session. So there's quite a number of bills to go through and monitor and track, and that doesn't even include all the amendments and budget riders that must be monitored. We have seen more and more at the Texas legislature that our world, in terms of everything that impacts school health, there's a lot of risk with bills that are filed. While they may be well-intentioned, they may have a negative impact in terms of implementation or some of them are not science-based. There's also a lot of opportunities with behavioral health being a priority in Texas right now. There's opportunities to encourage more physical activity, health and nutrition as part of that. But I just listed here a number of risks and opportunities. As everybody knows, we've seen the PE requirements reduced over the years. School health advisory councils, there've been more and more attacks on them. I don't see quite as many this session. Actually, nothing really harmful that I can see so far. But again, we're right, and when it gets kind of scary because amendments start flying around, and there's a lot of education bills. Health curriculum, we've always been trying to restore the health requirement for graduation. Not seeing that as an effort. A lot more burden on school nurses being discussed in terms of programs and part of the curriculum that they will be part of this session. Physical fitness assessments, so far there's been no attempt to repeal that. There were past efforts to provide more funding for physical educator training, not in the budget this time. We have seen a slight increase in chronic disease prevention in Texas. After the pandemic, there was a lot of return to school policies and waivers that were restored. As I mentioned earlier, there's a big focus, and rightly so, in behavioral health and mental health in Texas. And that's an opportunity for us to talk with lawmakers about the importance of health and nutrition and the importance of physically fit kids and all the benefits that come along. But I wanted to visit with you a little bit about the Partnership for Healthy Texas and our priorities that we have for this current session and where they are. And I also will share, I'm going to share an actual tracking chart that we have that's as of this morning live, and can share with you where some of these bills are. But before I do that, let me give you a little bit of background for those of you that may not be familiar with the Partnership for Healthy Texas. We've been around. Our mission is to develop and promote state policies that prevent and address obesity in Texas. So we look at what works. We set priorities for the legislature, and then with our team made up of various government affairs specialists and policy experts, advocate for those policies at the legislature and track them through the legislative process and engage stakeholders as necessary. Steering committee is quite a diverse group of folks, everything from Sustainable Food Centers, TAFOR, Texans Care for Children, Horse Action for Healthy Kids is there, Texas Pediatric, and onward. We do have some other coalition partners that are more resource and experts, being everybody from Texas Public Health Coalition to the Michael and Susan Dell Center to the MD Anderson folks. We formed in 2006 to work to try to come together. The goal was that everybody was doing their own issues at the legislature in terms of children's health issues. And while everybody was on the same path and trying to do good work, lawmakers were fielding questions and requests from different parties and different organizations, and that kind of diminished the return. And we decided to band together and develop with our experts, our researchers, and our stakeholders and advocates a list of priorities that the coalition could unite behind, and so that we could see some progress. And we did see that first year in 2006, we identified 6 priorities, of 5 of which we passed at the legislature, and 1 we were able to get at the state agency. So ever since then, we've continued to work towards advancing these policies in this type of structure. We do actually sit in a room, and every organization has the opportunity to bring forward their priorities, share what they'd like to advocate for at the legislature, and we then kind of assess the landscape of the climate of the Texas legislature. We identify what champions are available or willing to take up some of these policy issues, what type of science and research and support that we can lend to these policies. And at the end of the, right before the session, it's usually a couple months process. We unveil our legislative priorities. And we play a lot of defense too, because as everybody on this call knows, there's always last minute efforts to undo things, as we just discussed, or modify programs or curriculum or school health based initiatives that really should not be addressed in a certain way. And so we do move into defense mode this time of year more than anything. But what I wanted to share with you right now is some of the priorities we have for Texas through the partnership. Where we are, and I'm just going to hit on the ones that are actually moving. The first one is the vehicle asset test. It is House Bill 1287 by Ryan Guillen from the Valley. What the bill does is updates the SNAP vehicle asset test by applying an inflationary adjustment to the current limits. As we know, inflation has caused thousands of Texas families to lose their SNAP benefits due to the increased car values. And this is something I didn't even realize until this was brought to us by the Feeding Texas folks and the American Heart Association. And this legislation would index the SNAP vehicle asset test to inflation to better reflect today's car values, and which would not, this hadn't been adjusted in 20 years, and allows for Texans to work instead of choosing between food and transportation. And so this bill actually has been heard in committee, and actually I believe it's eligible for consideration by the full House. And so the groups are currently American Heart, Feeding Texas, and others in the partnership are advocating to try to get this bill to the House floor for debate. And it's got a companion bill in the Senate, and we'll have a tracking chart in a minute. We can share that to you as well. But Senate companion bill is Senate Bill 273, and it's co-authored by Senator Blanco from El Paso and Senator Sparks from Midland, Republicans. So it's quite a diverse group of supporters, and we are excited to see that. We're optimistic that it'll come out of the House and move in the Senate. We also have, again, I'm just going to talk a little bit about the issues that we know are moving. The next one under the Modernizing the Texas SNAP efforts is number 3, allocating funding for implementation of SNAP incentives and double up food bucks. Where we're seeing those double up food bucks is an opportunity to increase utilize your SNAP benefits. We put a rider in the budget, and it's currently moving through the House budget. And we've got it trying to get into the Senate version as well. Both the House and Senate have adopted their respective budgets, and there'll be a conference committee soon of 5 House members and 5 senators that'll finalize those legislative priority or that budget, and we'll be thick of it working to advance support for the double up food bucks. As I mentioned, there's a couple other bills. We don't really see anything harmful to PE and health or any of our required school health screenings right now. There was efforts that there will be a lot more efforts to opt out of everything from the physical fitness assessments to vision and hearing screenings, given the big move to provide more options for parents to opt into programs or opt their students or their children out of anything school screening related. There was a big discussion on that prior to the 7, given prior to the session, given the pandemic and the focus on immunizations. So right now, we've been fortunate and not see anything, but again, this is now where it gets tricky as people get sneaky and do amendments. So we'll keep an eye on those things. There is one bill that is moving through the process, and that is free care rule. And I'm gonna try to share. Let me see if I can do this. Or where we are with some of these bills. So right now, free care rules is in committee, and it's House Bill 1571 by Representative J.M. Lozano from Kingsville. And that bill right now has been pending in the Human Services Committee. And what that bill would do is would allow for schools to bill for student health services, provided all Medicaid enrolled students, they're all Medicaid enrolled students. No new expenditure to the state. Federal dollars will be pulled down through, and then so it would require the Texas Health and Human Service Commission to submit a state plan amendment for the Centers for Medicare and Medicaid Services to implement free care rule. So we're optimistic about the bill. It's had a great hearing in the House, and we'll be looking forward to moving those through the process. And then we also, one of the things we're going to be doing at the regulatory level after the session, we just felt it would be more strategic, had more support, and that was going to be to try to get Texas to implement a cost-saving initiative by including evidence-based treatments for health food interventions, pretty much including weight management therapies as part of Medicaid. And so we're going to be working with the Health and Human Services Commission to try to get that policy changed during the regulatory process. All these items have one pagers that you're welcome to visit on our website, Partnership for Healthy Texas, and get you a little bit more background. But I also do want to go back and share the screen here that shares where our bills are. We also have a bill dealing with food as medicine. It's a pilot project. It started out more of trying to encourage more healthy eating. This was a result of the House Select Committee on Healthcare Reform during the interim. The bill was supported by numerous groups in terms of obviously increasing health and nutrition to combat obesity and chronic disease. Unfortunately, the bill has turned into a pilot program focusing more on prenatal care for pregnant women and encourage them to eat healthier and obviously impact their delivery and obviously, gaining good health benefits. Not that that's a bad thing, but we were hoping it would be a little bit broader. But that bill was voted out of committee and is awaiting consideration by the full House. As I mentioned, we also have a bill that I mentioned, a free care rule. Let me go over some bills that are of interest. Here you'll see all these bills dealing with health literacy plans for the state. There's one this morning that was in committee, House Bill 1578. Our Methodist Healthcare Ministry folks are leading that effort, and that bill had a hearing this morning. I'm not sure how that went, by Republican Steve Allison from San Antonio. We also have eligibility for SNAP assistance programs for 12 months eligibilities, referred to that Senate Bill 75 by Senator Nathan Johnson out of the Dallas area, referred to Health and Human Services Committee. We do have, I'm just going to highlight a few bills. We've got, of course, the Food Access Grocery Store Initiative, filed by Representative Theory, waiting for a hearing in House Ways and Means. And we also have a health relating to the adoption of healthy and safe school water plan for public schools by House Bill 1123 by Representative Gervin Hawkins. That bill has been referred to House Public Ed. And we also have a bill that we're watching by Senator Middleton, Senate Bill 346, relating to prohibiting the purchase of certain food and drink items under the SNAP assistance program. And that bill gets filed regularly trying to deter folks from purchasing unhealthy foods. We do have House Bill 1599, express eligibility for Medicaid. That's actually passed the House. So that was a bill that the partnership supported, and as numerous other groups passed the House by 106 votes to 40 against, and it's in the Senate. We're also watching a few other bills relating to the establishment of the Office of Food System Security and Resiliency in the Department of Agriculture. Had a hearing in House Ag and Livestock. Waiting to see where that goes. I know Michelle will talk to us a little bit more about the Ken King bill, House Bill 359, House Bill 3589. There is a budget in the bill, in the bill. It ended up in Article 11 in the House, which is a wish list, funding for free and reduced price meals and school meals. So I'm not sure where that's going to end up, but it's in the state budget as an amendment. We also have, this was an interesting one. I think this will impact all school-based healthcare initiatives established to serve certain underserved students. That bill is Senate Bill 1966 by Carol Alvarado of Houston, focuses more on urban areas, providing, and this will be working with school nurses to help provide school-based healthcare initiatives, everything from behavioral health, dietary, physical activity, numerous programs that would be coordinated through the school system with a partnership with various healthcare programs. And there's a pilot project, and there'll be some funding tied to the bill. It was heard in Health and Human Services Committee a couple of weeks ago. It's not been voted out, so I'm not sure where that lies. But as I said, these bills are all moving through the process. We do have, as I mentioned, 40 days or so left of the legislature. And what that means is, time's ticking. So we have to get folks, some of these bills to move. I'm going to share another screen for the regular session as the date, some deadlines. So we're kind of there. We just passed the bill filing deadline, which was March 10th. We're coming up now in the House. They have a little bit more rigid rules, you could say. And their last day to get a bill out of committee in the House is Monday, May 8th. Of course, the session's 140 days, so that's the 119th day. But that's also considered pretty late to get a bill out of committee by then, because you've still got to work the process to get your bill out of the House, out of a committee, onto the floor. And if you look on the next date here, May 9th is the last day that the House will distribute their daily calendar for House bills to be debated. And those bills have to be debated by May 11th. So, we're already mid-April. A lot of these bills, only I think one, the Busey bill, has made it to House calendars. Actually, no, that one's already made it out of the House and over to the Senate. So the clock's ticking. And with the legislature ending on May 29th, that you'll see here, there is quite a bit to accomplish in this short period of time. And again, this is where everybody that's involved needs to keep their eyes and ears on these bills. Let us know about some of these things moving forward. I'm going to go back to my PowerPoint and talk to you about an opportunity. There's one opportunity coming up. The American Heart Association is doing an advocacy day on April 26th. Reach out to me if you're interested in coming to Austin to promote. They're going to be focusing on their Double Up Food Bucks program, trying to get that budget rider to stay in the budget. And so they're going to bring in folks from key areas of the state to target key lawmakers. So that'll be April 26th. Along those lines, these are ways to get involved from your respective groups, whether it's school nurses or your respective professional organizations. Get some, be part of these conversations, ask questions about where these bills are. There's, if you know some of these elected officials, they want to hear from you. Everybody on this call that's in part of our school system, you provide something unique in the sense that you live under these rules or laws or programs, and you see the impact they have, whether good or bad, and they need to hear from you. And we can help coordinate these visits through the partnership, or myself and Michelle. As we tell people, if you're not at the table, you're going to be on the menu. And so that means, if they're not hearing from school nurses or administrators or teachers, they're going to probably give you a program or take away something that's valuable, and they would have never, had they heard from you, the result might have been a little bit different. And there's ways to get involved. You can send emails to your lawmakers. Social media, follow them on social media. Feel free to have conversations with them about these bills on social media, because lawmakers do pay attention to their social media accounts. Many of them poll how they're going to vote on their social media accounts. Get involved in an advocacy day. As I mentioned, the Heart Association's got one coming up, specifically on double up food bucks. We also have, I think Tayford's going to do another visit in May, more of an awareness event. But you also need to start thinking about next steps is inviting lawmakers to come visit your schools after the session. There could be a lot of opportunity for them to come see, what a campus looks like during the school day and how these offices and programs work and the important work you do and the millions of things you're required to do or expected to do as a result of some of these bills. And so that's critical information to share with these lawmakers. So their call to action today is start meeting with these lawmakers after they adjourn from the session. There's still a feeling that we didn't realize PE is no longer required every day of the week for all students. Or that lawmakers will have said, I've heard them say, we didn't realize you don't have to take health as a requirement anymore. It's that lack of just understanding. And I think it's important for folks on this call to make sure they understand what really is in place and what's not. And work with coalitions such as Action for Healthy Kids, the Partnership for Healthy Texas, or any of your respective organizations. Get involved in their legislative teams, and it's not too late. I mean, literally, you have 6 weeks left of the legislative session. This is a great time to get involved. Get to know your lawmakers. They all come home on the weekends and go to church, do their grocery shopping back in their hometown. Be nice, be kind, but get information in front of them and become a resource for them. Many of them will want to call somebody that's affiliated in the school districts and working with school health programs and children, and they want to hear from you. They want to hear what it's like to be in these roles. When you got lawmakers that many are farmers or lawyers or doctors or business folks, last time they may have stepped into a school program as when either they were in school or some of their kids went through it, but things are different now. So we strongly encourage you to get involved, get to know your lawmaker. It's not too late right now. There's plenty of time to get to engage with them. As I mentioned, some of the key dates that have already passed, I won't go over those, but the session does end May 29th. It's a Monday, it's Memorial Day weekend. There's still some things that happen that day, but primarily, the next 30 days is when everything comes to a pass in terms of where bills are going to make it or die or get amended. So that's where it's important to be engaged. The governor's veto period is June 8th, 2023. He can do veto bills that pass. He can also line item veto a budget. That's why it's important, for example, on the double up box that we get overwhelming support on that budget and conference committee to get those funds earmarked, but also make sure that the governor's office as well is familiar with the ask and that they will be supportive of our efforts so that come June 18th, he doesn't take his pen and just line item veto that part of the budget. And let me say a little bit here about the budget. And I'm going to take a little bit of liberty here because I think it might be of interest. So everybody who's been hearing about the $32 billion surplus that the state of Texas has right now. I'd say by the first of the session, there was probably $60 billion in requests from all the different interest groups, lobby groups, et cetera. So these lawmakers have their have their plates full with trying to divvy up, and they're not going to spend all that $32 billion. And keep in mind, the comptroller is going to come back probably in a week or two with the new revenue estimate on the budget and say, Texas, you've got an extra $2 to $3 billion because the economy's been doing great. People are moving here from all over. They're spending money. These funds, taxes are coming into the comptroller's coffers, and you lawmakers have an additional $2 or $3 billion. So that's going to be a daunting task to figure out how to prioritize that spending, save some money for the rainy day program, and still get through the session with all the political issues that are out there. And keep in mind, here's what we're hearing, the chatter in Texas, and Michelle and I were just talking about at the beginning. I didn't get to elaborate much, but this voucher debate, while the House has already voted it down in the budget, as an amendment to the budget in terms of prohibiting state funds from being used for voucher programs, when they did that same amendments and that same budget discussion 2 years ago, the same amendment was adopted to the budget. There was 20 more votes to help pass that amendment to prohibit state funds from being used for vouchers. So there's been at least 20 less lawmakers that are against vouchers. What that means now is, it's a little tighter vote. The governor's pushing this hard. The Senate wants vouchers in some form or fashion. And guess what? You've got a state budget bill that's in limbo because it's the only constitutionally thing that the lawmakers have to pass is the state budget. If they don't, they have to come back for a special session. There's a lot of talk about leadership using the vouchers as an incentive to get some votes with the budget and little trading there. If you want this project back in your district, then you've got to vote for vouchers, or little wheeling and dealing. So it's going to be interesting to watch how the next few weeks play out in the session, what that means for vouchers, what that means for the budget, and what that means for all our programs. The other thing we have to think about is some of these policies that are impacting children's health in schools. If certain lawmakers don't vote a certain way, their bills could get caught in the crossfire and they get vetoed after the session ends. And it's happened to us before. We had passed this recess bill, worked with the governor's office, got it all the way through the House and Senate. This was, I think, in 2019. We were feeling exciting in the sense that we have a bill that would increase awareness and programs in schools for recess policies. And the bill got vetoed simply by friendly fire, because it wasn't even friendly fire. It was a senator that carried the bill for us in the Senate had blocked one of the governor's appointees. The governor retaliated by vetoing 5 of his bills, and that recess bill was one of the bills that got vetoed. So it's a frustrating process, but it's important that everybody stays involved. It's important that everybody shares their input on their respective area of children's health and school health and programs with lawmakers and leadership, and don't give up. There's so many ways to work policy and so many ways to get things done during the legislature. You just have to stay engaged and involved. And that's how today, if you aren't familiar with who your respective lawmaker is, we encourage you to go to this website, capital.state.tx.us. And at the bottom here, you can enter your address and it'll tell you who everybody is, from your congressman down to your state board of education to your state senator, your state rep, and you can start reaching out to them. It's important, again, if you don't know who they are, to get to know them. Reach out to them, talk to them, and ask them, how they're voting and how they're, or give them your input on certain bills. And again, that's why it's important that you highlight your work you're doing, everything from physical education, health, nurse programs, school programs. Invite them to your campus, share information from your respective organizations with them. Don't assume they're hearing and seeing all the information you're seeing. Overwhelm them with information. Get to know their offices. This will be some additional resources. The Public Health Coalition is another coalition that deals a little bit more with everything, including immunization, tobacco, cancer screening, and obesity. They utilize a partnership for the obesity priorities. Definitely want to follow up there if you want to get information on some of the bills dealing with tobacco, et cetera, there. There's a lot of movement on vaping bills moving through the legislature. Some are good, some are bad. But you know, this is the best place to go look into some of those. Partnership for Healthy Texas, you can get our one pagers and get our priorities. The Michael and Susan Dole Center have numerous great resources here, everything on children's health status reports, great one pagers and everything from obesity, lack of PE, screen time, sleep, everything impacting our children, and some data. And they also have a legislative tracker request. I'm sorry, this is a little outdated. It should say the 88th legislature. A lot of those bills you saw earlier on my tracking list, they have a little bit broader list on everything dealing with nutrition and school health. Great place to go look. Of course, on the Cooper Institute, we have some FitnessGram, just at home programs and educational about staying healthy and physical activity. With that, I think that brings up my time, and I know Michelle has a few things she wants to share, and I'm going to stop sharing my screen, but I am not going anywhere. I'll be around if there are any questions.
Thanks, Joel. You're informative as always. I appreciate your sharing. Did you mention the recess bill? There was one filed by Representative Allen.
I didn't. It has not had a hearing yet.
Not
sure.
looking promising,
No.
which is sad because like I said, it was passed last time and then the governor decided to veto it, which is frustrating. So I wanted to talk specifically about one of the bills that is on that list, House Bill 3589. 20 years ago, we worked with the then Commissioner Susan Combs and school nutrition directors and a lot of different people to move the school meal programs from under the supervision of Texas Education Agency to place it under the Department of Agriculture. Several things caused this to come into being. There were some discussions with a lot of the soda companies who were not willing to work with the Department of Ag since they had no authority on vending machines in the schools. They were allowed just free reign to have as many machines and whatever they wanted in those machines. And so we looked at that and looked at a lot of different things. And Susan Combs went to USDA and said, what do you think? And they said it was fine if the governor approved. So the governor said, yes, let's move this bill, or let's move this department. They have done a phenomenal job over the last 20 years of supporting school nutrition. So we were really concerned and surprised when this bill was filed to move it back from Department of Ag to the Department of Education. We're not even sure if the Department of Education truly wants this, but the bill was filed and it's it was passed into the State Affairs Committee. So we've been working with several different people, organizations to make State Affairs Committee members more aware of what's going on. We developed this one pager with some of the key reasons it should stay at the Department of Ag. Part of the issue is that at a federal level, it's under the USDA. So having the education agency working with the USDA is kind of a misnomer, and there's really not a lot of depth of experience around child nutrition at TEA. The fiscal years can have an impact on how things are reimbursed. Several of the programs would have to remain at the Department of Agriculture, and then several of them would be at TEA, which could cause duplication of efforts, same staff members or different additional cost to both agencies. So we, like I said, we developed this as well as a couple of other pieces. One where the, the current chair of the Texas Association of School Nutrition and the immediate past chair shared their thoughts on a move like this and what it would do. And then they actually went out and polled the different states to see what their feelings were. And 13 states were responded. And out of the 13, I think 2 of them felt that they had a good relationship with their Department of Education, but the majority felt that it was challenging to work through a Department of Education on things relating to school meals. Then the other piece that we developed was from past child nutrition directors. Several of these ladies and the gentleman, John Perkins, was the assistant Texas Agriculture Commissioner. He actually started at TEA, then he moved over when the program moved over. And they all expressed their concern with this move to TEA from the Department of Agriculture. This is a list of all of the different reasons why it really shouldn't move. So we have quite a bit of good information that can be shared out. We've also developed a list that shows who's on that committee, and the list itself actually has the contact information and a link to the website. This is just showing you where these representatives are. And it hasn't moved in the State Affairs Committee. It hasn't been put down for a hearing. I don't know if it will be. One of our bigger concerns is what Joel mentioned earlier. It could sit there and not get out of state affairs, but if you'll notice, Representative Ken King is on the Public Education Committee. So there's a very good chance that he could try to put an amendment on an existing education bill to get this passed. And then it wouldn't get a hearing, it would get no visibility. So there is a definite need to make sure that legislators in the House understand the consequences of a move like this. It's not just saying, oh, we're going to move this and everything's going to be fine. It is a huge program, and having it moved without having a good reason why, what they're going to be gaining by moving this away from the Department of Agriculture and into the Department of Education is beyond me. So if you have any interest in this, you can reach out to me and I'll be happy to share these recesses as PDF files, as well as, the list of legislators. We'll also share the public education members, because I feel like it wouldn't be a bad idea to go ahead and start contacting them just in case it doesn't get out of state affairs, but there is a chance that it does get put on an amendment in the Public Ed Committee or on the floor even. So we've got to make sure that our legislators understand the consequences of this type of a move and what it could actually do. So I think there's a couple of, I know there's maybe a question or a couple of comments in the chat. Let me check those real quick. Thank you, Joel, for an informative update. And then everyone is muted by the presenters. Yes. Was there someone that wanted to be unmuted to ask a question? Or you can definitely put something into the Q&A or into the chat. So is there, excuse me. So if anybody has questions, now is the time while you have Joel. And I think he did a good job of sharing kind of the schedule coming forward, what we've got coming down the pike. I would suggest to signing up at the partnershipforhealthytexas.org if you want updates on information. And then we'll definitely share some information out, but Action for Healthy Kids does not do a lot of advocating. This is something I'm personally kind of engaged in because I was there when we moved it in the first place, and I feel like it's really a problem if they try to move it back. Okay. Excuse me. I have thank yous, but I have no questions. Okay. So there's one more webinar from our organization on May 10th about the importance of outdoor play, which is going to be a really good webinar. You can find additional information on that on our website, and this link will be active in the PowerPoint that we follow up and send after this session. And my contact information will be there as well. If you're looking for videos and webinars on different topics, we have a lot of them posted on YouTube on everything from social emotional health to parent engagement to recess. So visit our page on YouTube and you can use those videos for different types of meetings that you might be having with your school health advisory council or your parent groups. So that is it. If no one has questions for us, we will let you have a few minutes of your day back. I know everybody appreciates getting those extra minutes back these days. I thank you all for joining us, and I hope that you will take Joel's advice and visit the Texas legislature online, find out who your legislators are, and reach out and share information with them and share how you feel. You don't have to call them. If you go to the website and you click on your legislator, there will be an email form you can use right there to send them an email, and just send them an email and tell them what you think. Tell them how you feel about school vouchers. Tell them how you feel about recess or physical activity in the classroom, or school nurses. We definitely could use some more support around school nurses. So it doesn't even have to be tied to a specific bill as much as it does just helping educate them about what's important to you as one of their constituents. So do that, and you will make all of us happy, and you'll make your legislators more informed. So thank you, and have a great rest of the day, and we will hopefully see you on another webinar in the future.